Hey everyone, it's Aaron. Welcome back to my channel. So today is a very important day. Today is Monday, October the 30th, and it is World Hypophosphatasia Awareness Day. So for those of you who do not know, I live with hypophosphatasia. I talk about it a lot. I've talked about it on this channel. But hypophosphatasia, if you don't know what that is an ultra rare genetic metabolic bone disease. So it's caused by a genetic mutation in your tissue non-specific alkaline phosphatase gene that causes the disease, causes these symptoms that I have, that I've experienced. So what is that? So for me, I was born with signs and symptoms of this disease. I was born with bowed legs, and that's a very common sign of hypophosphatasia. And throughout my childhood and even to my teen years, I'd broken a lot of bones and I experienced a lot of bone pain. Especially, I remember the growing pains that I would have would be so severe, like way more than anybody typically experiences. And so by the time I was 18, I'd broken a lot of bones. I had surgery when I was 20. I'd have my hips totally replaced. When I was 24, I had to have those replacements taken out and put back in. And I had severe osteoporosis and all of this stuff prior to my diagnosis. I mean, the disease was really affecting me, but nobody knew what was going on. And that's because it's extremely rare. It's classified as an ultra rare genetic disease. So ultra rare meaning it affects very few people. For me specifically, when I was first diagnosed, the geneticist was like, this is about 1 to 200, 300,000 people. So very rare for the type that I had. So when I was going through all of this, all of the ups and downs and the bone and all bone breaking and all of that, more than anybody should, nobody really thought anything. So I was diagnosed with Crohn's disease when I was 17. So about 8 years prior to my hypophosphatasia diagnosis. And I was malnourished and had to be on a little bit of steroids, and there was just this assumption that that was probably it. That was making my bones do all of these weird things and be weak, and saying that I was clumsy, I fell a lot, and so they just kind of chalked it up to that. When in reality, there was something a lot a lot more rare going on, but something else going on also, something that's very serious and can be very detrimental to patients who have this disease. So the reason I share my story and the importance of today is because part of it is that it took me 25 years to get a diagnosis. There were the doctors that I saw and the tests that I had and things that showed up and got flagged in my lab work was never talked about, and that is due to a lack of education. And I know that in the medical field because I'm in a program where um, they pair me up with medical students, and we talk about my rare disease and what all of that is. And every single medical student I've talked to is like, yeah, we don't even we don't go over that, and like we go over a lot of stuff, but that's not something that comes up. And even the physicians that I have seen, locally and tell about my disease are like, yeah, we've never heard of that, and one or two have been like, yeah, it sounds familiar, but we've never seen it or treated it. That's just part of it. I mean, this is a really rare disease, and not every disease that everybody can have is talked about, right? But there are certain things that I think should be flagged. For instance, one of the hallmarks of hypophosphatasia in terms of like lab work is that your alkaline phosphatase, which is an enzyme very important for bone health and the enzyme that is affected in hypophosphatasia, your level is very low. And people may think, well, what if you don't get tested for that? Well, so there is a test, the comprehensive metabolic panel, that pretty much everybody has had done at some point in their life. It's very, very common. It has your alkaline phosphatase level on it. I had that test done. I mean, I went back as far as I could, and I mean, I had probably 20 times, maybe more. It's a very common lab work that they do to check a bunch of things. I mean, sometimes you have it as part of a routine checkup, so it's very common. And the level being really low is always flagged in the system, but it's not. There's really nothing else about it that comes up. It's flagged as low, and I've talked to some of my friends who are physicians and the doctors that I've seen, and they're like, yeah, when it's low, we don't really learn about the low part. We learn about when it's high, because when it's high, there are these more common or more well known diseases that are related to that. But when it's low, they don't really do anything. Even though it's flagged in the system as low, it doesn't really trigger anything for anybody. When it should, right? Like you think that a level like that that's really low should trigger something for somebody to maybe try to seek it out and see what's going on. But you're not really taught about it or taught to look for it or what to do if it's low, then what do you do? So how do you get a diagnosis? And a lot of times it's just being with the right doctor at the right time, being with a physician who had maybe seen it or heard of it or had some sort of clinical referral for it, and you just got lucky and they were like, oh yeah, this triggered something in my brain. So part of that too with the program that I'm in, where we meet with medical students and talk about our diseases and things of that nature, is that's part of that. That's educating them on this disease, and hopefully, even if they don't go into a field that you know treats hypophosphatasia, but if for some reason they get a patient that has a low alkaline phosphatase level, they remember that they're like, oh, I remember Aaron from when we had our conversation. We need to do a little more digging, and it's a really cool program to do. But it it all feeds into days like today, awareness days. That's why I do that. That's why I'm in a program like that. That's why I'm making this video and share my story. Is this disease is really rare. It is. There's not a ton of people with it. I mean, I know people with it, but through the internet, but there's not a lot of people with it. And when there's not a lot of people with it, and doctors aren't seeing it, then they don't know what to do when it comes across their lap. So today, World Hypophosphatasia Day, I like to take just a moment like this to share my story, to talk about what hypophosphatasia is, to talk about what I've experienced, and hopefully it helps somebody get a diagnosis sooner than I did. It took me 25 years to get a diagnosis, and I've shared my story, my diagnosis story with hypophosphatasia, but a little bit of it is that when I was 24, I was doing a master's degree, and I dislocated my hip replacement doing nothing, getting out of bed. I got out of bed, I twisted my hip, shifted out. Had to go to the ER, and it was a whole ordeal, and ended up having to have my hips completely redone. So they went in and they took the implants that I had in, replaced them, lengthened my legs to kind of stabilize everything, and that was the turning point for me when I realized that I was like, there's something else going on. I don't know what it is, but I have a feeling that something is wrong. And so I started digging. I Once I kind of got through that trauma of having my hips replaced for the second time, I started digging, and I came across hypophosphatasia. I came across my own medical records of very low alkaline phosphatase and did some digging. And long story short, that I've shared a bunch of times, is that I was right. I talked to my physician about it. He agreed. He sent me to a geneticist who also agreed, who did sent the genetic testing, and it came back positive for hypophosphatasia. I diagnosed myself basically, and I was right. And I just knew something in my gut was wrong. I knew that there was just something else going on that nobody was doing anything about. And the fact that I had my hips replaced that many times by the age of 24 was just a red flag. It really was. And not only that, I was devastated, and I had to take more time off school, and it was an emotional thing. And I just knew something was wrong. So I did something about it, and I was right. And if I would have been wrong, I would have been wrong, but I wasn't, and here I am. So a little more about my journey with hypophosphatasia. So here where I live in Mississippi, the doctors that I saw were not familiar with this disease, and they told me that they would send me somewhere else, just to a physician who treated this disease more and could better handle my care. I appreciated that. So I go to Nashville, Tennessee, to Vanderbilt. I see a doctor up there who's incredible. She does a ton of research in this area. She's seen a lot of patients with this disease, and it's been life changing for me. It's been disease changing, I think, in terms of putting me on a better path, putting my disease on a better path. I got on treatment. The only treatment that's available for this disease is an enzyme replacement injection that I do 6 times a week. So it's had such a giant impact on my life. And as I record this video this week, November the 2nd, I'm having my 24th surgery and maybe 25th surgery related to hypophosphatasia. I'm having my MCL in my left knee completely reconstructed because it just wouldn't heal and it detached from the bone. It was injured and the whole thing. But that's my fourth surgery of 2023. I had surgery on my radial nerves this year because I had some calcifications around the tendons that were compressing the nerve, and I had a knee arthroscopy for a meniscus tear and one other thing, and so it's been a tough year for me for hypophosphatasia, my disease, and um, uh, I still think it's important to share my story, and I think it's important for others to share their stories if they're comfortable. But especially with a disease that's super rare. I mean, it's very rare, and it's very challenging to get a diagnosis. And the longer it takes to get a diagnosis, the longer the disease, you know, wreaks havoc on your body and your skeleton. And while the treatment is great, it's not a silver bullet, but it definitely slows things down. It's something that has very much helped me in my journey. And while I still experience issues related to hypophosphatasia, it's nothing like it was. There are so many things that have gotten better. But there are things that I still deal with every single day. I mean, again, I've had multiple surgeries this year alone, and I had multiple surgeries last year and the year before, and so it's a very challenging disease to live with. There are forms of this disease that are lethal. There are babies, infants who are born with a more severe type of the disease, and unfortunately, you know, they do pass due to the disease because of how severe uh, a couple, one or two of the types are. So yeah, there's never enough awareness for this disease, and today is the spotlight on that. Today is the day where we share our stories even more and talk about this disease, talk about hypophosphatasia, and just try to get it on people's radar. Not only that, anytime I do an advocacy day, I talk about not only is it important, when it's important for us to share our stories and it gets the word out. Not only that, it helps raise money for the disease. It helps, which goes to research, and we need a ton of research on ultra rare diseases because part of it is there's not a lot of people with the disease, so it can be very hard to study it and get funded and things of that nature. So the more money that we can raise and awareness we can raise genuinely helps push the science along. So it's World Hypophosphatasia Day. If you have any questions, please let me know. If you ever have questions, please let me know. I'd love to go into a little more depth of hypophosphatasia and what it is and some of the more nitty gritty details of the science behind it, and I will one day. But today is just about awareness. Today is sharing my story and hopefully uplifting other stories and the work that others are doing as well on today. So happy World Hypophosphatasia Day. If you have questions, please let me know. If you're a fellow HPP or hypophosphatasia patient, uh, please reach out. I love to connect with other patients. And thank you for listening. And please, again, share this with others if you think that it'll be of interest to them and other patients. And the more that we can get the word out, the better. So happy World Hypophosphatasia Day. I hope to hear from you and look forward to seeing your stories as I continue to share mine.